My name is Nolan Fiola. I'm a current fourth year at Drexel University College of Medicine. Fell in love with Drexel right from the start of the process when I came down and saw the city of Philadelphia, which I had never been to before, and seeing the campus. Knew it was going to provide me with a good education, and also was really aligned with the things I wanted out of a medical degree, like community outreach and working towards goals of primary care and preventative medicine. For me personally, one of the things that I really wanted to emphasize in that third year as I transitioned to more of a clinical day-to-day schedule is I really wanted some consistency in my work schedule, in my work experience. So my clinical experience at Reading, I can't brag about it enough, to be honest. I think it's one of the best decisions I ever made during my 4 years of medical school was to come to Reading Hospital for a whole year. I felt like the faculty did a great job keeping me engaged and also making me want to participate, want me to contribute, want me to advocate for my patients. And, you know, at a lot of times, even during busy days, sitting down and giving us that time to teach us is invaluable. This is a place where I never felt afraid to ask questions, a place where I never felt afraid to contribute, a place where I felt like my voice was heard in a lot of the different rotations that I went through. The faculty at Reading, they know that they're at a teaching hospital. They know that part of their job description is to teach not only the residents, but, you know, carry that over to the students as well. And I think that they take that part of their job really seriously. It was good enough to the point where I even requested having additional rotations at Reading into my fourth year. You know, I'm going into family medicine. I did my third year of family medicine at Reading, and then especially requested to come back to do my fourth year sub-internship there as well, and just being able to have two opportunities to work with the same faculty and a lot of the same residents in the same clinic, I really think makes you feel even more part of a community and part of a team. I think what a lot of people seek out in medical school to feel like they're in a home, away from home, and I felt that while I was there. Advice that I would give to students coming into the clinical years: keep an open mind. I know that not every rotation or that every experience is going to be something that you're necessarily looking forward to going in, but I think if you are just thinking about it from a patient's perspective, and that every rotation and every experience is an opportunity to work with patients and to listen to people's problems and to be a part of a team, I think having that perspective really helps. Having the new campus in West Reading, having it be so close to Tower Health Reading Hospital, I think will be an extension of what Drexel has already done in Philadelphia. You know, it will provide students with the opportunity to establish a lot of the things that Drexel University has already done for the Philadelphia community, having some of those student-run clinics for a lot of the communities that are in need in Reading, in the West Reading area, being able to have that hospital nearby, even in your first 2 years for some preliminary clinical experiences, I think really goes a long way.